Okay, so this is part 2. We're going to continue with the respiratory system. It is also one of the 12 body systems, and its responsibility is for air intake, gas exchange, and air expulsion. So let's take a look at the different elements of the respiratory system. We're not going to be going over all of these elements. There are certain ones that we want to focus on, but I did want to give you an overall picture of what this respiratory system looks like. From the naval cavity to the diaphragm, to the lungs, the larynx, the trachea, and so on and so forth. So the first organ we're going to talk about is the lungs. And the lungs are responsible for the exchange of gases from the air. Air contains many different components. The air extracts oxygen, the lungs extract oxygen and get it to where it needs to be in the circulatory systems that we just took a look at, and it gets rid of waste products like CO2. The larynx is the portion of the trachea. We're going to take a look at the trachea in just a second. Commonly referred to as the voice box. It's where your vocal cords are. You can actually probably, if you hum and put your hand on your larynx, you can actually feel your vocal cords vibrating, and that's what creates sound and allows you to speak. So the trachea, also known as the windpipe, that's kind of the informal term for it, is a cartilage-lined pipe that carries air to and from the lungs. So air is going to enter basically through your mouth or your nose. It's going to travel through the trachea into the lungs. We're going to talk more about airflow and the process of that here in just a minute. Okay, so how does the body take air and turn it into something usable like oxygen? That's where this occurs, in the capillary bed. It's a place where gases are exchanged due to diffusion. In this process, oxygen is taken into the body and into the bloodstream, again through the lungs, specifically through the capillary bed, and CO2, the other gases the body does not need, then are expelled, and this occurs in the capillary bed. Cilia. These are tiny hair-like structures, and as you can see, it looks kind of cool here. The cilia are the things that are moving in this picture. They line the air passageway and help keep it clear. Sometimes if you cough up some mucus or something like that, that's part of the cilia gathering this, so to allow the body to expel it. This, by the way, is one of the reasons why you don't want to smoke. These are very delicate structures, and they have a very important job. And if you smoke, you're basically taking tar and just tarring these things. So it's something to keep in mind. One of the reasons why we don't want to smoke. Okay, so continuing forward, the alveoli are the tiny sacs in your lungs that allow for exchange of oxygen and carbon dioxide into the bloodstream. So we talked about how the lungs work to exchange gases. The alveoli are the mechanism by which oxygen and carbon dioxide are actually exchanged, and oxygen gets into the bloodstream and carbon dioxide comes out. Again, we talked about smoking. This is another reason why you don't want to smoke. These are very delicate structures that do very important things, and like I said, if you are smoking, all the stuff that's in that cigarette is basically just on this, and it's obviously, if you know somebody who smokes, when they try to do something physical, it's harder for them, and this is why. Okay, something we want to make sure we're aware of is the pathway of respiration. This will be on the test, and it is pretty straightforward. It's just kind of the thing you want to go through a number of times to you understand it. It's something you don't want to overthink. It's really straightforward. Mouth, nose, then the pharynx or the throat, then the trachea, then the bronchi, then the lungs, then the air sacs or the alveoli, which we just discussed. Okay, so pathway of respiration. Pause this. Go back through this if you need to. Will be a question on the final. Okay, so some medical conditions that affect the respiratory system. A very common one is asthma. on the left is a normal airway. When asthma occurs, that airway gets constricted. It kind of tightens up, if you will, and mucus can build up, thus not allowing the normal passage of air through the airway, and that's asthma. Some common asthma triggers are environmental factors like pollen and things of that nature. Also things like exhaust and industrial output that goes into the air. Also carcinogens like smoking, things of that nature. Asthma can be treated relatively easy, but it is something that's important to be aware of. Okay, so moving on, last part of this unit, we're going to take a look at the 6 components of health-related fitness, and there's some other stuff that doesn't really fit anywhere, so we're just going to put it at the end of this. So let's talk about what these are. There are 6 fundamental components of health-related fitness. They're standard, they're just something you need to know, and they're something that are kind of building blocks for everything you do from a fitness standpoint. So cardiovascular fitness is the ability to exercise the body for long periods of time. These are your runners, your cyclists, your swimmers, people who can elevate their heart rate and have it elevated for long periods of time, sometimes hours at a time. But that's cardiovascular fitness, which makes sense. Your cardiovascular system is in good shape, and it would therefore allow you to do these things for long periods of time. This is not to be confused with, say, bench pressing, which is not cardiovascular fitness. It's a different kind of fitness, which we'll take a look at in a second. Muscular strength is the amount of force you can put forth with your muscles, right? So one person is able to let's say bench press 100 pounds. They're exerting force on that bar, which allows them to actually bench press the weight. Another person can apply twice as much force, for example, and bench press 200 pounds. That is what we refer to as muscular strength, and it's all about force application. Muscular endurance is similar to muscular strength, with the exception of muscular endurance refers to the number of times that you can do this. If you know anything about CrossFit, this is a really good example of muscular endurance. It's one thing to be able to bench press 100 pounds once. It's quite another thing to be able to do it 20 times in a row. So endurance speaks to the length of time or number of reps that your muscles can apply force onto an object. Flexibility, one that gets overlooked a lot. Flexibility is one of the more important things as you get older that you want to make sure you have and you maintain. But flexibility is the ability to use your joints fully, right? If you've seen somebody who's had an injury to a joint, there's restriction there in movement. They've lost flexibility. Maybe you know somebody who is able to, who is very flexible, very agile. Flexibility is again just the ability to use your joints fully. Oops. All right, body composition. Body composition. The best way to think of this is just what is your body made of? It's that simple. Body composition is a percentage of body weight that is fat compared to other body tissue such as bone and muscle. If you take a look at the example on the left here, it's just breaking down what your body's made of. It has a male and female example. Obviously, you want your body composition to be within a normal range of fat. That's something that's considered quite a bit. This is something that America kind of wrestles with in terms of body composition and what percent of the body is made up of things that are unnecessary, like excessive fat versus muscle and things of that nature. Okay, stress management is another health-related component of fitness. And it's real straightforward how your body reacts to stress in your daily life. If you've ever felt stressed about something, there's usually a physical component to that as well. Maybe you start sweating, maybe your stomach hurts, something along those lines. Stress management is the ability to take on stress, keep it in its perspective, manage it in a proper and effective way. Okay, so those are the 6 components of health-related fitness. Now we're going to take a look at some just kind of miscellaneous stuff. One of them is the best places to take your pulse. There's 2 places we want to keep in mind here. One is a carotid artery, the other is a radial artery, and that's what the picture is representing. The radial is on the left, carotid is on the right. These are arteries, and we talked before about how arteries aid the heart in pumping blood to the rest of the body. There is a pulse there. Which means you can see what your heart rate is through that. You can't really put your hand on your chest and feel your heart, although sometimes you can. So the 2 best places to take your pulse are the radial and the carotid arteries. Okay, blood pressure. Blood pressure is the amount of force your heart's using to pump blood. In an unhealthy person, we talked about cholesterol. We talked about being unhealthy and the lungs having to work harder to exchange gases, things of that nature. All that's going to do is make your heart work harder and therefore have a higher blood pressure rating. A healthy blood pressure rating, and there's a lot of kind of a scale here, but healthy is like 120 over 80. If you see 120 over 80, you're good to go. When you start getting that number higher, and I provided ages on the left, but really we're talking about 120 over 80. When you start getting that higher, what it's doing is it's not good for your heart because your heart is overworking itself. It's a lot like a person. A good way to think of this is a normal person can just walk normally. A person with high blood pressure, it's like you're walking with a weighted vest on, and the higher your blood pressure, the more weight that vest has in it. Eventually you're going to get tired and you're not going to be able to do it anymore. That's the issue with the heart. Okay, so that's why our blood pressure is important, and we want a 120 over 80. So if we were going to if we were talking about somebody who might have high blood pressure, besides diet, which we're going to take a look at in the next unit, some exercises that would help lower that are things like our cardiovascular endurance, our first health-related component of fitness we talked about. So you might ask that person to run, bike, or swim, and you'd start low and you'd elevate that, and over time, if the person's stuck with the training regimen, they should be able to do longer distances and do these faster and keep their heart rate higher. The heart at the end of the day is a muscle, and it's a muscle that can be strengthened and trained, and just like with other muscles, if you don't use them, they atrophy or they become weaker. If you put stimulus on the muscles, if you make it work, it's going to get stronger, because that's how muscle works, is it repairs itself. So this has been the whole of the first unit: cardiovascular system, respiratory system, 6 components of health-related fitness, and some other items.